I hope you and your family are safe, and I hope you are well. And if you have been unwell, I wish you a speedy recovery. Now, these have understandably been hard times for most of us, mostly because it was unprecedented, there was no preparation, and mostly because this virus, COVID-19, has been very difficult to understand. We all are still reeling from the second wave, when now there has been a sudden rise in the cases of mucormycosis, also known as black fungus, making those who are already suffering from COVID particularly vulnerable to this disease. Now, there's a whole round of preparation that we as a country, you as an individual, or as a family need to do for the third wave, which is why we're having another edition of India Shield's webinar, where we are going to be talking about how to fight the black fungus and the third wave with Dr. Ritesh Malik. Now, he's the director at Radix Healthcare, and he's a medical graduate who took a detour from conventional medicine to follow his passion for entrepreneurship. Dr. Ritesh has been named in Forbes 30 Under 30 Asia, Fortune 40 Under 40 India, PwC and SPH 40 Influential Indians, Business World 40 Under 40, and many other prestigious lists. However, for the past year, Dr. Ritesh has collected an accolade that's nothing like any other list. He has been working on the cause for COVID at his family-owned hospital in Delhi called Radix Healthcare. Now, the institution has treated over 5,000 COVID patients in IPD and OPD. It's vaccinated over 30,000 people. And Radix has been a nodal center for remote treatment in these times of distress, treating thousands of patients remotely to ensure that the load on the hospitals is only for very severe COVID cases and mild and moderate cases that can be managed with home or virtual care. So welcome, Dr. Ritesh. I'm Sanjana Chauhan, and we've seen what the second wave has done, giving rise to perhaps the need to bust myths, educate ourselves about a completely new mutation maybe, and also understand what's coming next. Over to you, Dr. Ritesh.
Thank you very much, Sanjana. Thank you very much for the opportunity for sharing knowledge on what is impending upon us. Human race, not only India, the human race has been swept by the panic and cruelty of the coronavirus disease, so-called COVID. So COVID, very few people know this. COVID stands for the coronavirus disease, or said to have been allegedly originated in the Wuhan city of China. The whole idea that every century has a particular pandemic, and for this century, the pandemic is one of the worst in the history of mankind, and also on the backdrop of the fact we never thought that in this day and era we will not be able to deal with a disease which is by an enemy that is semi-living and semi-non-living. So these are times of distress. My purpose to join India Shield's mission today is to ensure that history does not repeat itself, because it always does. In 1300, the pandemic took millions and millions of lives. In 1918, the pandemic took again millions of lives. And in 2020, again, the same happened. History will keep on repeating itself until and unless we are prepared. And the best preparation is knowing the right information. So that is the purpose today. And I take this opportunity to introduce you to a very new world of what is going to happen post the second wave. What are the post-COVID complications? How you should take care of yourself and your near and dear ones to ensure that you are not a victim of lakhs of people who have been succumbed to the unwarranted loss of life throughout the world because of COVID. And we'll talk about a lot of interesting things about what happened in the first wave, the second wave, and the third wave. So to set the context right, Sanjana, this is very interesting. In the history of all pandemics, if the first wave was 1x, the second wave has been 8.94x, and the third wave has been 3.8x. We are definitely going to have a third wave if we are prepared well. the loss of life would be extremely low. If we are again careless, what we did after the first wave, we are going to see the unpreparedness will lead to significant loss of life. My submission here is as follows. For the next 2 to 3 years, we are going to have COVID in our lives. Let us accept that. Let us not think that COVID is going to go away in the next 1 or 2 months. COVID is going to coexist with the human race, and we need to be extremely vigilant, not anxious, but paranoid. And for that, the first, the first basic thing is recognition of symptoms. Fever, tiredness, dry cough, along with diarrhea, loss of smell, taste, and sore throat. We have heard these things time and again, but when they happen, the first thing that the patient feels is that I would not have gotten COVID because I wasn't going out of the home. Do not take this prejudice. And the first thing that you do is you will not talk to your doctors. You will not take any medicine. The first thing that you do on origin of symptom is that you will isolate yourself. Isolation is one of the most powerful weapons that we have to breaking the chain of transmission for yourself and your loved ones in your family. The first thing, and I'm again reiterating on this thing, very few people are adhering to this. I did not adhere myself, and I was the reason that my entire family got COVID positive in the first wave because I waited for the test to come positive. And usually the test takes 2 to 3 days to come. And in that point in time, I actually infected my entire family. So please ensure any of these 6 symptoms until and unless proved otherwise for the next 1 to 2 years, consider yourself as COVID and at least isolate yourself. That will at least break the chain and help your near and dear ones become at least safe. The second thing that you should know is the reason why COVID is such a large panic in the world is that the incubation period of the virus is extremely large. That means that if I met Sanjana today and she had COVID, my symptoms will come after 9 to 12 days. That means that after getting infected, it will take me 9 to 12 days for my symptoms to originate. Because of which isolation is extremely important so that you do not further transmit the disease to others in your families. We have created something called the code for COVID. C stands for consult. The moment you have these symptoms, talk to your doctor. Talking to your doctor is so important. Doctors have seen COVID in magnitudes of cases, and they can guide you for your genotype, for your comorbidities, for your age, on what you should be. Do not treat yourself with information from the web. Talk to your doctor. Don't panic and talk to your doctor. Second is observe. When it comes to observation, there are 2 metrics that can be significantly be controlled, and those are our temperature and saturation pressure of oxygen. When it comes to temperature, I would like to pertinently mention here that people are unnecessarily popping a paracetamol the moment their temperature goes beyond 98.6. In the new studies, because of global warming and India being a subtropical nation, we've seen that you should not pop up paracetamol until and unless your fever goes beyond 99.8. Please make sure you do not pop a pill until and unless your fever is beyond 99.8. In India, any temperature between 97.56 to 99.6 is considered as normal temperature. The third thing is don't wait to isolate. And the fourth is early medication. When you send your samples for testing, at least start medication. The best friend to help you win COVID is early medication. That does not mean that you start taking hostile drugs which are only for prescription, but that means take over-the-counter drugs. Take zinc, take vitamin A, take vitamin C, take vitamin E. Do a lot of steam and gargles. I'll tell you 2 very handy methods to eventually prevent the third wave are steam and gargling. Steam will help in viral shedding. Make it a habit to do steam for all family members in your family at least once a day. That will really help clear your sinuses. That will help clear your nasal passages. And if there is any exposure to the virus, there is a chance that the virus is actually shedded during the nasopharyngeal stage. At the same time, gargling with half a teaspoon of salt in lukewarm water once a day really helps in clearing your throat. So ensure that you do preventive things, especially for the next 1 to 2 years, because you will be exposed to COVID virus, whether you like it or not. Same time, let us talk about testing. Testing has been our healthcare infrastructure when it comes to testing is extremely poor, because of which we are also seeing in a lot of cases in which testing cannot happen, especially at the peak of pandemic. Things are now in control, but I would just like to mention that even if your RT-PCR or rapid antigen test comes negative and your symptoms continue, you are not supposed to break your isolation. You have to understand that RT-PCR and RAT test, which is the rapid antigen test, have a very high index of a false negative test. So ensure that you are in safe hands and isolated. It is better to be safe than sorry, and be isolated for at least 9 to 12 days until your symptoms are completely vanished. At the same time, if you're not able to get RT-PCR or RAT done, ensure that you get a CT done on day 6 or 7. CT is a pretty much gold standard for detecting COVID once you have a false negative case is on both the metrics. At the same time, I would like to mention that when it comes to the medication for COVID, we should know why are we indicating these medicines and what is the thesis behind it. A lot of people ask me, COVID is a viral disease. Why do we give an antibiotic? The reason is that antibiotics have shown to decrease viral load in 48-hour in vivo cell cultures. At the same time, virus leads to decrease in our body immunity, because of which there is a very high chance of getting a bacterial infection, because of which we do a cover of antibiotics so that in attenuated immunity levels, we do not get a super bacterial infection. Multivitamins have shown to decrease the viral load. Antivirals like favipiravir, which have been significantly used, have shown to decrease the load of viruses with actually inhibiting an enzyme called the RNA transcriptase. There's a medicine which is very popular in developing nations like India called ivermectin, which is truly an anti-parasitic, but has shown very good results against the COVID virus as well. In the first 72 hours, if you use inhaled budesonide, the Lancet Respiratory Research showed significant decrease in conversion of an asymptomatic or a mild disease into a moderate/severe disease if you take inhaled budesonide, and ensuring that you take a nebulizer if you are already an asthmatic. These drugs should only and only be taken in consultation with your family physician. Now, coming on to a very, very pertinent, important topic, and that is steroids. Steroids, I can be very confident about it, have been truly abused in our country for managing COVID. We should understand steroids are not for every patient. Every patient does not need steroids. There are very few patients out of the entire spectrum who need steroids. Steroids are a two-edged sword. How steroids work is that steroids decrease the markers in our body, which can cause an autoimmune cytokine storm. Steroids like dexamethasone and methylprednisolone are only indicated in patients whose fever is not subsiding even after paracetamol. It is only indicated in patients who have an extremely high CRP/deranged blood levels of various COVID markers, and not in every case. So please ensure, I've seen a lot of patients against the advice of doctors are popping up steroids. which is leading to the next biggest challenge in front of us, which is called mucormycosis. Let me take this time to tell you what a mucormycosis is. Wherever all of you are sitting, where I am sitting, we have microbes around us. We have fungus, we have bacteria, we have viruses, all in our vicinity. The thing is, in normal routine, our immunity levels are so high that we do not need to worry about mucormycetes, which is the actual fungus which leads to mucormycosis. But but in cases of COVID, where immunity is already decreased because of abuse of steroids, slash slash, in highly diabetic cases, or in patients who have been on oxygen for a very long period of time, they develop something called the mucormycosis, which is colloquially called the black fungus, which is technically a misnomer because it is not black in color, it's blue. But mucormycosis as a disease has a very, very dangerous outcome, and the prognosis is only 40 to 50% of the patients are able to survive mucormycosis, and the treatment is not available at scale because, again, we as a country were not prepared for this complication. So mucormycosis is, you should understand, as fungus comes in our body through nose or through your mouth or through your eyes, and starts in an already decreased immunity structure, starts infiltrating our face areas, and it is of two types. One is primarily towards your nose, your throat, and your brain, or your eyes. And the second one is the lung black fungus, which directly hits your pulmonary parenchyma. My only submission is all the diabetic patients who have been on oxygen slash who have been heavily exposed to steroids should get an ENT consult if they have rhinitis, which is allergic running nose, if they have redness in their eyes, if they have any symptom relating to ENT. This disease is so time sensitive. If you treat it in course of right early 48 hours, the prognosis increases from 50% to actually 85 to 90%. So ensure that all the comorbid immunocompromised patients who have got COVID have a very high level of suspicion for mucormycosis, and try and keep them in the most sanitized environments. This disease is sweeping up the nation, and now this has been named as a pandemic in 5 of the states and 1 union territory, which is Chandigarh. This is something which is the next large cause for us, and the primary reason is overabuse of steroids. Now, I would just like to talk about how the vicious cycle of COVID it hits us. We should know that virus is typically it's not even a living creature. It's a non-living crystal, which when comes in our body, enters our cells, and the moment it enters our cells, it starts igniting an immune response. And for killing the virus, because it is in our cells, our immune response starts killing our own cells, which leads to symptomatic symptoms of low SpO2 and increases our fever, etc. So we need to understand that virus this is not a bacteria. This is one of the worst forms of infections, and we need to be prepared for the third wave. And on the front of the second part, which I would like to tell everyone, especially who are comorbids, we are seeing extremely high chances of having a clot formation. COVID leads to a very high D-dimer outage in our body, which leads to post-COVID clotting. Now, post-COVID clotting means that in essential organs in our body, there is a chance that a clot is formed because, in colloquial language, our blood gets thick. For that, we need to give anticoagulants. My submission to all the patients who have recovered from COVID is that they should keep on getting their D-dimer tests done. And if your D-dimer is high, take anticoagulants. If IV, take a Clexane. If non-IV oral, take antiplateletic drugs, which will, like aspirin, which will decrease the chance of you getting a stroke or a heart attack. The whole idea, now let's talk about the third wave. One, the third wave will come because we cannot, as humanity, we cannot stay in a lockdown for the next 3 years. The choice is upon us whether we want to have a highly spiked third wave like the second one, or we want to have a very attenuated, mild third wave. And the reason why the second wave if came was survival of the fittest, the Darwin's theory of natural selection. When the virus understands the immunity amongst humans is increasing, the virus for ensuring that its legacy continues, the virus starts mutating, the virus becomes more virulent, the virus becomes more infectious. And because of that we have seen a pathetic second wave result in our country. For this, we need to understand the third wave infectiousness and virulence of the virus will be higher than the second wave if we do not create our herd immunity. Herd immunity means that 70 to 72% of India's population needs to get vaccinated, at least in the large cities where densities are very high. If we do that, we will be able to ensure that at high mutation rate of the virus decreases, and that is the only way for us to win the battle. My request to all of you to prevent the third wave is just ensure wear a double mask. Whatever happens, be paranoid, consider whoever you are talking to has COVID, and ensure that you do not lose social protocols. Create sanitary bubbles in your houses and don't let anyone break it. Do not breach the sanitary bubble. We have seen unwarranted loss of life because someone was careless and he didn't wear or she didn't wear a mask and got the virus to their homes, affecting their upper or lower generation, out of which a couple of generation family members did not survive. And they are actually going through a lot of mental trauma because of guilt. The whole idea is wear a double mask, be extremely sanitized, ensure that you only go out when it is required, and be paranoid at least till herd immunity is achieved in our country after getting vaccination. Now, let us come to the most interesting topic, and that is vaccines. Now, how do vaccines work? Let's talk about vaccines. In a very normal language, vaccine is all about creating artificial ability to fight the virus. What we do is we have a whole virus vaccine platform in which we enter the dead virus in a human body, which is the platform used by Covaxin of Bharat Biotech. This is also used by conventional vaccines like hepatitis A, rabies, polio, measles, etc. We have an vaccine, which is a messenger RNA vaccine, which is the platform used by Pfizer and Moderna. The side effects of these are significantly lower than the other vaccines because we do not enter any virus in the human body. We have a viral vector vaccine. Now, what does a viral vector vaccine mean? The Covishield platform, the AstraZeneca platform is based on this. We do not take the full virus. We just take one of the viruses is a protein and induce that into a non-harming adenovirus and put that into a chimpanzee and take the serum from there and inject in a human body. These are different platforms. A lot of people ask me, which is the best vaccine? I say the best vaccine is the one which is given in time. Whichever vaccine you get, ensure whenever your chance comes, get vaccinated. A lot of people ask me that after vaccination, we are seeing on the news that there are people dying. That is all from the magnitude of the vaccinations. That is all so minuscule. That's a 1 in a million chance. There are higher chances that you will die of COVID than you will die of a vaccine from COVID. That is the only way. Getting vaccinated is not only for your personal protection, it is for the protection of your community, it is for the protection of your society, it is for the protection of your country. It is your national responsibility to get vaccinated, and all the vaccines are safe. You will not, these cases that you hear in which clot formation has happened, these are extremely remote cases, and these cases are in individuals who are extremely elder and who have significant and comorbidities, and the direct relationship with the vaccine inoculation has not been proved yet. So my submission to all is that get vaccinated, and that is the only way for us to be beat this international calamity. Over to you, Sanjana.
Thank you so much for that, Dr. Ritesh. And as grim as the situation is, and really the impact that the second wave has had, and how violent the mutation of the virus is, I think I'm going to go out on a limb here and say that all this information that you've shared has actually reassured me, because now I feel armed and equipped to understand the third wave. So thank you so much for putting that in perspective. Dr. Ritesh, this is something that I've actually been reading a fair amount in news reports. I'm currently in Bombay, in Maharashtra, where the state government is at the moment trying to build preparedness by having a lot of pediatric wards when it comes to the third wave. So is that something you can comment on? Are we looking at maybe the third wave impacting children a lot more than we have seen in the last two waves?
Yes. So, Sanjana, if you see, if you recall in the first wave, our largest worry was for people who were above the age of 60, 65. We were not bothered when a 27 or a 29-year-old, we should not call child, but a young adult got the virus. Now, if you see the second wave, there has been, this is very interesting, 65% of all cases are below 60 years of age. 65% pan-India, all cases are below 60 years of age. Now, the reason is that we started mass inoculations above the age group of 60. The more, and this actually proves the point of vaccination, the more we vaccinate individuals towards the higher age group, they start getting more, or they start developing the artificial immunity to fight the virus. Now that we have started vaccinating individuals between 18 and 45, the thesis and what the history has taught us is that there is a very high chance that and especially in the backdrop of the fact that India is the youngest nation in the world, this is something which is very concerning, that we will have a heavy chance of our children being affected by the virus. That being said, slightly good part in all of this grim situation is that children so far have not shown extremely high mortality, except of the fact that they do develop something called the MSIS syndrome, which is post-COVID, which mimics the Kawasaki disease. But apart from that, due to COVID, my 5-month-old daughter got COVID, and after a week, she was absolutely fine. So we should not panic much, but at the same time, make sure that our children are protected. And a lot of people ask me, how do we prevent? Because still there has been no vaccine that has been given an approval for children. So I always tell them, do 3-4 things. And one, talk to your children about COVID. See, this is very important, because even a 9 or a 10-year-old child in today's age is so equipped with mobile and with so many things. You should talk it out. You should set the perspective right so that they're not scared. Because at this point in time, a lot of children, because my dad is a pediatrician, and a lot of children are scared that what happens if my parents die? This is now more of a mental disease than the virus itself. Out of 100, 87 people will absolutely be mild or asymptomatic. And there is a mass hysteria, panic because of news channels. And they should be responsible in showing content, because in India, news channel is actually looked at as not an adult content, which it should, because it's so grimming for them, and the effects on child psychology are humongous. Apart from that, my submission to all of you would be, who have kids, once you tell them about COVID, they would follow the mask philosophy. They will follow what double masking is in one of the Delhi schools. And you see, people like us, you and I, have not been able to actually adhere to the social distancing and double masking norms. How can we expect our kids to do? The only way is to have this be spoken in at homes, to get the context right, to get their immunities built up. Give them amla, give them natural. See, Ayurveda and allopathy both should go hand in hand. Allopathy has its own merits. Ayurveda has its own merits. take amla, take things which are very high, green leafy vegetables, ensure that they are very well hydrated, steam and gargling as an exercise, and leave COVID aside. Steam and gargling are very, very productive for your health. So my only submission is do not panic, but at the same time, if you yourself are vaccinated, there's a very high chance that you will not infect your younger ones. So get vaccinated. I cannot emphasize on this enough. Get vaccinated. It ask me any question that you have, but at India Shield, let us take this pledge that we will not, you'll be amazed. We have 7 lakh villages in our country, and we work with a lot of panchayats, and we do a lot of work with them. You'll be amazed, Sanjana, villagers are not willing to get vaccinated because of comments made by some senior leaders who are promoting a lot of Ayurvedic stuff. Unfortunately, they are not able to make up their mind for vaccination. People who are not getting vaccinated have a very high chance that they will die because of COVID. So vaccines work, and vaccines will not, and I should also create a disclaimer here. Vaccines will not protect you from turning positive. There is a chance that you still might turn positive because the virus is mutating. This vaccine was developed for COVID-19, not COVID-21. These are two different viruses. But that being said, vaccines will protect you from death.
Thank you so much for putting that in perspective, Dr. Ritesh. So, for everybody who has children, please ensure that you at least start talking to your children about it, because I think we've gone past the thing that this is going to go, that this is going to we're going to see it off. It's here to stay. COVID is here to stay. We kind of need to understand how to navigate our way around it. And for all of our attendees, thank you so much for joining us. Please continue to send in your questions. Whatever comments you'll have, we're going to try and take all of them. So Sahil Doshi now asking a question, Doctor. Many analysts have suggested a W-shaped recovery in COVID cases. We are already seeing a gradual decrease in the cases recently. So he's asking your opinion on the recovery in the ongoing second wave.
When it comes to recovery in cities like Bombay, in cities like Delhi, like Bangalore, where there has been either self-imposed lockdown or a mandatory lockdown by the authorities, we have seen a significant decline in the number of cases. Even if you talk about the reported cases being the metric to judge, I truly believe that we have achieved our peak and we are going to go down. Now, the biggest challenge is, again, the moment the lockdowns are lifted off, what is going to happen is that we are going to again see, and the biggest challenge is our cities are so dense, our cities are so densely populated that it is absolutely, we almost have populations of countries like Australia within our cities. We cannot, and as a country, I also empathize with our government. It's very easy to criticize, but I feel that as a country which has 137 crore Aadhaar cards, which has a GDP healthcare budget of under 2% annually, whereas the US budget is 90.8%. How can we cure in a disease where the incubation period is 9 to 12 days, and at the same time, the virulence and the infectiousness of the virus and the mutations are so fast. So my only submission to all of you is that once the lockdown gets lifted, do not take this as a known fact that COVID will not return. COVID virus is until unless 70% of our India's population, which is close to 99 to 100 crores, gets vaccinated. Even single vaccines work. Gets vaccinated. At least what is going to happen is we are going to develop the herd immunity. Out of every 5 people, only 1 person will become infectious, and because of this, there'll be a break. We just have to break the viral transmission. That will break the mutation. That will break the intensity and virulence, and eventually COVID will become a very normal virus. So Sanjana, I would like to mention, I don't know whether you recall this or not, but measles as a vaccine. So measles is a whole virus vaccine, which is a dead virus which we send into the human body. In Disneyland in 2019, there was an outbreak of measles because typically in that particular area of Disneyland, vaccine of measles was not delivered. Now, just imagine, just because of that particular thing, measles outbreak took so many lives in the US in 2019. Now, just imagine, and if these are the virus only gets strong in communities where there isn't any immunity. We need to develop our herd immunity as soon as possible. This should be every organization's agenda. Leave the country. This should be your personal agenda. Second, it should be your family's agenda. Third, it should be your community's agenda. Then, so far and so forth, it should be the world's agenda. All the resources should be on vaccination, and vaccination is the only way out. Else, we'll always be in the cyclical cycles of the virus going out, then peaking out. And not only W, we will see multiple Ws in the coming years.
Quite a few questions asking Doctor about the duration. And I remember that was a bone of contention, just a lot of back and forth between the health ministry and the ICMR also kind of deciding duration between the first and the second dose. So why has that been increased? And really, just to kind of throw in a sub question over there, the gap that you have when you have COVID and actually taking the dose, why is that going back and forth in terms of, the increase and decrease?
See, Sanjana, there are 2-3 things. One, the virus is so new. Anyone who tells me that I know about COVID it fully, I always is laugh at him. I say that there's whatever I was saying last year, being very candid, a lot of those things are actually not true in today's day and age. I used to always say that it's a disease which gets transmitted by surfaces. Now, when we speak today, the chances of you getting COVID from a surface being an airdrop of disease is very high. Being an aerosol disease is very high. So anyone who says so, we are consistently evolving and we are consistently fighting with a virus which 2 years back wasn't there in this universe. So because that's a new disease, it is such a new virus, as healthcare professionals, as government authorities, we are learning, we are contemplating data, we are so usually, and also you should know, this is very interesting. Do you know even a single medicine or drug which has been given an approval for fighting the COVID virus? There is actually none. All the medicines / vaccines that have been approved, nothing but emergency approvals given by countries only to ensure that we are able to control the transmission of the virus. Vaccines also have an emergency approval, and because of that, things are consistently changing. Things are consistently changing. Things are consistently getting more and more or clearer with us. So because of that, we are seeing that there's a lot of back and forth which is happening from the government side, from the authorities side, and from the health community, and typically also when it comes to a large country like ours, where supply of vaccines is such a challenge, there's a very high chance that the government would want, which is actually true, that at least one shot should be given to everyone, and then we'll figure it out.
Absolutely. So I think this is also another question that a lot of people are asking, but Giri Kumar asks, which vaccination is better? Covishield, Covaxin, any comments on the single dose Sputnik? And also in terms of, Doctor, if you can kind of just break it down about why there is a single dose for some, why there is a double dose for the others.
Yeah. See, again, reiterating it, whichever vaccine is shot first, take that. Because I know a very dear friend of mine, not naming him, he belongs to a very industrious family. And the day the government started the vaccination for 45 and above, I called him up and I said that please get yourself vaccinated. He said, no, I will get myself vaccinated from a Pfizer. I will go to Dubai and get a Pfizer instead of getting a Covishield or a Covaxin. Unfortunately, he is no longer with us and he got succumbed to the virus. I cannot emphasize enough, do not wait for what vaccine I will get, because see, governments take time. We were expecting Pfizer to be cleared way back in February, and today we are touching June. So governments take time. We do not know when the availability of vaccines will come. Please do not wait it for any vaccine in whichever is available today. And also there is, you have to understand the first vaccination was done on January 7 in India. It's not even 6 months. We do not even know till when the immunity of the vaccine will last. We don't know that. I was amongst the first people in India to get the vaccine. So my only submission is twofold. The first one is get whichever vaccine that you have, get yourself that. The second is you should also know that there's a very high probability that the chances that you will need consistent vaccines year on year as booster shots are very high. We are going to see an amalgamation of AstraZeneca with Pfizer, maybe, of Covaxin with Novavax, maybe. So there'll be a lot of research and studies will come. In the meantime, temporary safety from the peaks of COVID is extremely important. We have lost millions, and I can guarantee we have lost millions. Just imagine a country like America, the most developed nation in the world, losing 6 lakh individuals. In Kargil war in 1999, we lost 529 army martyrs. In 9/11, September 11, and we lost close to 2,900 individuals. 6 lakh people dying because of an enemy that we cannot even see with the naked eye. We have to take it so seriously. And again, reiterating, Sanjana, whoever is listening to this, don't worry about anything. The government has cleared lactating mothers. The government is scrutinizing the effects on pregnant ladies. In the US, they have Foxy has cleared pregnant ladies. Any and everyone can get vaccinated. Please talk to your doctors. If you're scared, get yourself jabbed.
Absolutely. And I think that's another thing about, the vaccine. Would it be possible, just given that there is, of course, a crunch at this point of time, there is a shortage, in Maharashtra itself, they had kind of moved the vaccine, the second dose vaccines, the first dose vaccines, I'm sorry, to the 18 plus group to ensure that the population who already received their first dose got the second dose. So in the likelihood of that actually happening, would it be possible to mix doses? Is that an issue if you say have a Covaxin and you get a Covishield after that, or another vaccine after that, whichever one comes to India? Would that be problematic?
See, again, there is no data, and we don't know what will happen after mixing vaccines. That is why we are highly recommending for now that if you have taken a Covishield, take Covishield. If you've taken a Covaxin, take a Covaxin. And let's wait for data. At the same time, almost all, and also when it comes to Pfizer and Moderna, we need to understand we are a subtropical nation. Our temperatures is between Delhi and Kanyakumari are very high. And we need to understand this, that cold storage capabilities and infrastructure in India are limited. That is why Covishield and Covaxin work, because they need cold storage temperatures between 2 degrees and 8 degrees. Whereas a Pfizer or a Moderna need up to -8 degrees, which are technically in India a question mark right now at scale. So we need to understand that. And also when you compare a Covishield versus a Covaxin, you can imagine, see, a Covishield has been given almost 18.5 crore people. And Covaxin has been given to around 1.5 to 2 crore people. So it's very difficult to compare whether after Covaxin you can take a Covishield. And there have been actually right now our first idea is not on research on what will happen after mixing the vaccines. It is that get yourself vaccinated, increase capability of vaccination production, and get as many vaccines as possible. Forget the clinical trials. If America is using Pfizer, let's not even do clinical trials. Let's get them. Why have we not gotten them? Very few people know this. Pfizer actually entered India, talked to the ministries in January. They said that we want to partner with India. And they said, no, we will first like to get a lot of clinical trials done. How on hell can the government be so callous about this? they should have immediately given an emergency approval. As such, except of oxygen, all medicines, be it remdesivir, be it ivermectin, be it tocilizumab, be it any medicine which is there for COVID is all in emergency approval. So it's extremely important that now we focus on getting all the vaccines in this world, irrespective of the costs, and get India back on track.
I think we have some more, questions with regards to the vaccine. Mahesh asking, what are the common side effects after getting a COVID-19 vaccine? Because I think some people have experienced, the chills and fever and, an arm ache. Some people have actually shown up to work the next day completely all right. So does it vary from person to person?
It varies actually. Out of at least I can tell you about my subset, we've vaccinated close to 30 to 40,000 people. We've seen around 38 to 40% develop mild symptoms, but those are temporary, 36 hours to 48 hours maximum. Apart from that, this is something that a lot of people are scared of it. There's no one who's more scared of needles than I am. So I've got myself vaccinated. So I know for some people needles are scary, but still my wife had to hold me along with my dad to get me vaccinated. So I'm not the right person, but if I can get vaccinated, trust me, anyone can go and get yourself vaccinated. Don't worry, you will have fever, will have mild chills. Even if you have that, that is much better than being in COVID. See, COVID is not about the disease. It is about the mental harassment it gives you. When you get COVID, it's not the virus that you are getting. What you get is, you get that Aaj Tak, you get at India News, you get all the channels in this world who tell you that there's a chance that you are going to go into Nigam Bodh and you are not going to survive this. So that mental harassment, when I got COVID, the only thought I had was that should I prepare my will or not? So my submission to all of you is, be safe from COVID. Don't go into that. It's a very scary situation when you get COVID. And also, Sanjana, COVID is nearer to us than we think. We always, as Indians, we have this propensity to always think, कि यार हमें तो नहीं हो सकता. Why will we get? मैं तो बाहर ही नहीं गया. I've not been exposed, and how can I get it? And they get surprised when their RT-PCR comes positive. So it can happen to anyone. It does not see caste, creed. It does not see how much money you have. And for the first time, the human panic is because it is affecting the rich and famous equally as it is affecting the poor and vulnerable.
I think that's so valid that you kind of even address that, because that is definitely the thought that everybody has, that it's not going to happen to me, or it's there, it's outside the house, or it's just the neighbor, something like that. So I think that is really important that you kind of address that. Doctor, let's just move a little now and just focus on mucormycosis, or also known as black fungus, although you said that that's inaccurate to actually call it that. But Rupa Patel asking this question, but you did recommend steaming and steam inhalation as something that we can do as a preventive measure. She says that would steaming not create a moist ground for the black fungus? Some school of thought are actually discouraging steaming. So would you agree with that?
So first of all, mucormycosis will not affect 99% of all of us, 99.9999%. It affects a very, very small subset. It affects extremely small subset, and that particular subset is only and only affected because, so we should know about mucormycetes, which is the fungus, is the name of the fungus which causes the black fungus. Now, it likes three things. It likes sugar, that is glucose. It likes ferritin, which is increased because of COVID in our body, and it likes an immunocompromised body. Now, the moment you have these three things, that means if you are diabetic, if you are post-COVID, and if you've been heavily exposed to immunosuppressants, / if you have been heavily exposed to oxygen, there's a very high chance that you might get mucormycosis. Steam will not give you mucormycosis. All the studies are still under trial, all the studies, and maybe 1 out of, say, 1 million people who have developed mucormycosis, the chances of that from being from steam are absolutely remote. Steam is one of the measures which actually will give you significant viral shedding. And for a normal, I would also like to tell, for a lot of people post-COVID say that, yeah, I'm having rhinitis, I'm having redness of my eye. He's not diabetic, he's not having, he was not on oxygen, he was not on immunosuppressants, he had a mild infection. He will not get mucormycosis. It's as simple as that. My mucormycosis is for severely ill, severe patients of COVID, not for everyone. So you don't need to worry. You do steaming. Obviously, if you do steam in water, which is stale for 3 days, that is a cause of concern. But apart from that, if as long as you're using fresh water, hot water actually kills all the microbes around. That is why hot water is extremely and in fact, if you have a fungus inside your nose, it actually kills that fungus as well. So steaming is actually good. So you don't need to worry about that.
So, somebody also asking, Ritik asking about immunity, and I think somebody else has asked that question. They've not left their name. About one is, of course, how to increase your immunity. And is there a certain measure? Like, is there a way to say that, oh, my immune system is really great, or I have great immunity? And he also wants to know a little about white fungus.
Got it. So see, when it comes to immunity, there are 3 things. Now let's keep COVID aside. Let's take general human body needs to be extremely immunoresponsive. Because for that, what you need to do is be hydrated. Hydrated means drink a lot of citrus juice, drink a lot of nimbu pani, drink a lot of haldi ka milk, drink a lot of juices, drink a lot of water. Keeping yourself hydrated is one of the best ways to get immunity, because all these things have a lot of vitamin C, citrus, a lot of minerals. Apart from that, ensuring a very high protein diet. See, when it comes to the protein diet, high protein diet will always increase your immunity. Apart from that, at doing things like, for example, eating an amla every day, having things like chawanprash, these are things which will really help you out and will ensure that you will not have challenges, especially with, now you'll be amazed, mucormycosis is present everywhere around us. But in usual instances, when mucormycosis occurs, we have such a strong immunity that we do not get any challenge because of that.
I'm sorry, I have to quickly come back to vaccination because our questions
Sure.
are populating around that. Another very crucial aspect, doctor, is that, given that the third wave is likely to impact children, when will the children's vaccination, do you reckon, be possible in India? Somebody also messaging, I think Mahesh, he says, I'm 17 years old, so vaccination is not allowed. What kind of precautions can I take?
First of all, as we speak, there are a lot of companies worldwide who are working on the vaccination program for children under the age of 18. Second of all, when it comes to vaccination, if you see, we also have Covaxin that is working. Pfizer has almost neared its clinical trial conclusion. And we will see children start to getting vaccine, in my opinion, by the next quarter, at least in the US. When it comes to the 17-year-old young gentleman, I would just want him to have 2-3 things in his mind. One, that at usually below the age of 18, at least for the second wave, we are not seeing extremely severe cases. So first of all, he should not be worried that he's not getting vaccine so soon. Obviously, he should get himself vaccinated the moment it comes, but not to worry. Apart from that, do all these things: do steam, do breathing exercises, to keep yourself hydrated, and do gargles and all. These are very basic things which will all in all help you with your immunity. And even if, God forbid, you get COVID, you will not have a very severe one.
Thank you for that. Doctor, another very interesting question coming in from Sahil. And I actually personally know a lot of people that are practicing this about UV rays, UVC technology being effective in disinfecting surfaces and, of course, the air as well. So do you find that useful as well? Should maybe people kind of take opportunities and take that chance to get their home sanitized with this?
So there have been very limited clinical trials, I'm a very scientific person and I always rely on significant clinical trials. That being said, there have been claims that UV rays does as help in disinfection. What I can say is that pure sun rays, especially in tropical countries like India, can at least help you in disinfecting your masks if you want repetitive usage. But the best way to disinfect your home, especially post COVID, is by using a traditional sanitizer, which actually comes with a bag which has huge liquid inside it and which goes through every surface. That is a better way. I'll be more comfortable using that. But there have been actually we haven't spent a lot of money on research so far. That is something which is extremely important. We are wasting so much energies, efforts. There are companies that are wasting so much of capital on disinfection. We as a company, we are India's second largest co-working space called Innovate, and we have so many spaces, and we keep on disinfecting using all the kinds of disinfectants that are there, and we still don't know which is the best.
Absolutely. I think, like I said at the start, it's so hard to kind of understand, the virus in itself. Birendra Yadav asking this question, and this is something else that even I had on my mind. A lot of other people have asked that question as well. You spoke about herd immunity, and that's something you've constantly been alluding to in terms of like everybody getting vaccinated. But in your opinion, is there ever going to be a time when 70% of the population are going to be immune? So, and when do you actually see that happening? Because I do believe that given the crunch right now and the shortage of vaccines in our country, it's probably going to be a while.
It will, in my calculation, 811 days. I had done my simulation, but I hope we do it much sooner. I think the biggest challenge now for vaccination would in fact not be it'll be affordability. See, we are a country where 91% of the population earns less than 8,400 bucks every month. For them, getting a 1,500 rupee Covaxin or a 1,000 rupee Covishield is still, and especially for 4 to 5 members, is something which is still a larger burden. Very few people know this. The largest cause of personal bankruptcy in India is healthcare. So we are one of the poorest insurance adopting countries in the world. This is also an opportunity for us to think more about our healthcare infrastructure. We boast about the Bharat insurance, 50 crore people getting insurance. Our healthcare infrastructure is not primitive. It has not even been born yet. It's so rudimentary as we speak, and redundant in fact, and because the government does not have the capability of building healthcare institutions, they rely on private healthcare services, and if you see in the past 1 decade, there have been over 1,500 hospitals that have been closed down, the smaller hospitals, because of the fact that the government relies all their efforts, and in disaster management asks them that you cannot charge more than this to a particular patient, because of which they are not able to A, deliver quality, B, actually they make a lot of losses because of that. So all in all, a lot of food for thought for us, for doctors as well. I think these are times where we also should perhaps do more sessions on mental wellness. We are all scared, including I am. I'm very scared. I don't know what will happen. We're scared for our children. We are scared for our businesses. We are scared for our livelihoods. So this is a time when what I can tell everyone is that we will all pass through this. Everything will be fine. I can vouch, because we are going in the right direction. At least vaccines are here. We are going into help each other. Platforms like India Shield. I was talking to Yash Raj. He's done a lot of hard work helping people. We need more Yash Rajes. We need more of Sanjanas. We need more people giving the information, the right information, empowering people, not only in English, 16 languages, Marathi, Tamil, isko convert karna chahiye. The whole idea is for people to be equipped with the right knowledge. We don't have enough doctors. Let us become COVID doctors ourselves, in terms of at least doing the right things. At the same time, let us help each other. After 1947, this is the largest calamity Indian race has ever seen. Let us help each other. You can just help each other by just talking to a person who's affected by COVID. Even financially, you can help. Just make sure if you have the privilege of getting 10 people vaccinated, let's get them vaccinated free of cost. If you are able to do that, you will be doing the best service for them. You'll be saving their lives, and you will be doing the best service. You will become an army. You'll be doing service for your nation.
I think it's so wonderful that you actually kind of talked about vaccine being a national responsibility, because unfortunately we're completely out of time. I haven't been able to address some questions, but a lot of them had to do with the fear, with the hesitation, with a lot of superstition around vaccine hesitancy. I work in public health, and I've seen that as well with other vaccines as well, with drug hesitancy in general. So I really think it is imperative at this point of time to really drill it. And I think everybody watching this should also kind of understand that if you are getting vaccinated, you are doing yourself a favor, you are doing your family a favor, you are doing this country a favor, you are saving lives. So please go out and get vaccinated. Like I said, I'm afraid I'm completely out of time, but thank you, Dr. Ritesh, for this extremely informative session. I think you spoke about fear a lot. You spoke about mental wellness. I do feel, although you have kind of been candid enough to say that you are fearful, what you have done is allayed a lot of fears and answered a lot of questions and, busted a lot of myths. So I think that's really, really the biggest takeaway. And for everybody who's watching, please remember, consult, observe, don't wait to isolate, but in the meantime, build immunity. The third wave is coming. It's imminent. All of us are going to be exposed to the virus, if not already. Maybe you'll be exposed to it again. So educate everybody around you. And really, don't just depend on an RT-PCR that has a high rate of, false negatives. Stay at home and please stay safe. Thank you so much, everybody, for watching. And thank you once again, Dr. Ritesh, for joining us and, allaying everybody's fears. Thanks a lot.